I have any people about this?
No, I'm just doing her.
I know.
Good evening, ma.
Yeah, good evening.
How are you today? Please, ma, what's your name?
I am Akwaja Benedict Mkiri.
How old are you, ma?
I'm 41.
Okay, ma. Are you married?
Yes.
With kids?
Yes, I have 4 children.
Can we see them?
Okay. That's my first daughter.
What's your name?
My name is Solomon Chibu.
Okay. Where's your brother?
And that's my son.
Okay. And this.
And the 2 girls, the last babies, they are the twins. They are
Okay.
3 years old.
Okay. Okay. All right, ma.
Come out!
Why were you admitted to the hospital?
I was diagnosed with breast cancer.
Okay.
And this is my husband.
Okay, sir. So what's your name?
Okay, Pastor Douglas Akwaja.
Okay, sir. Okay, ma. You said what brought you to the hospital?
I was diagnosed of breast cancer. That's why I was referred to this place.
Okay, when were you diagnosed?
It was at Shema Christian Hospital.
How long ago?
About 3 to 4 months ago.
3 to 4 months ago.
Yeah,
That was when they said you had what?
my breast cancer.
Okay.
Yeah.
So what were your symptoms?
The symptoms were general body pains,
Okay, ma.
more especially the waist, the chest, and the ribs.
Okay, ma. So since then, what treatment have you been receiving?
Condition. Except if you have enough blood, you don't need any blood transfusion, you are not get to that amount.
Okay.
And I am expected to take this chemo like 6 times, apart from other treatments that will be involved. And then the surgery as well, you have to go for blood as well, and pay for the theater, pay for other things. A lot of money is involved. So if we can say it will take up to 400,000 to 500,000.
That's like half £1,000,000 naira.
Yes, yes.
Okay, ma. Now, after the surgery, is that where your treatment will end, or you still need to continue taking treatment?
Oh, no. The surgery is not supposed to be the end of the treatment.
Okay.
According to the specialist,
Okay.
they said that they are carrying out the surgery to stop the spread.
Okay.
And then to continue with the treatment to make sure they get rid of the cells in the blood.
So you still continue the chemotherapy, or what other therapy now?
They have been expected to continue with the chemotherapy,
Radiotherapy.
and also have need for radiotherapy because of the lymph node. I have one lymph node here and one also at the armpit. So there are need for those things, the radiotherapy, the chemotherapy, until it will be completed.
Okay. So after the surgery, you still have to spend that over 100,000 for each chemotherapy as you did.
Yes,
Prior
except
to the
if
surgery.
anything otherwise happens.
Okay, ma. Thanks for the time and everything. And you said you've been able to improve. Can you show us one of the improvements? Like you said, your hands were paining you initially. You couldn't raise them up. Can you raise it up so we'll see?
Yeah, I can raise it now.
Okay, what else can you now do?
I can talk.
Without assistance.
Yes, without assistance.
Okay, what else can you now do?
I can also stand.
Okay, can I see you stand? Can you walk? How much? Very little. Oh, that's good. It's okay. When you walk, do you feel any pain?
Yes, for now I feel some light pain at the back, at the spine, and at the waist as well.
Okay, it's alright. Okay, ma. Thanks for granting the interview.
You're welcome.
Okay, God bless you. What have you been receiving?
I've been on chemo. I've taken the chemotherapy, the first course, second and third course.
Okay, ma. So, have you been improving? What can you say about the chemo?
Actually, there's improvements.
What kind of improvements?
Well, at least when I came here, I could not use my body. I couldn't sit down. I cannot stand up. Can't walk, but now I can sit down. I can stand. I can also walk around a little.
Okay. Now, this chemo, what were the side effects on you?
Well, as you can see, the first side effect is the bad hair you are looking at.
Okay.
That's the first side effect.
What other side effects have you had?
Sometimes I have stomach upset,
Okay.
difficulty in having appetite for food,
Okay.
and then bone pains.
Okay.
Gives bone pains, it clears off within 1 or 2 weeks time.
Okay.
These are the side effects, and it also brings down the blood level.
Okay. Okay. So, how long have you been on sick bed?
Actually, I've been sick for like 7 to 8 months.
7 to 8 months.
Yes.
Okay. But for how long have you been in this particular hospital where you received the chemo?
Okay. This about 3 months I've been here.
Okay. So now what can you say about when you came in and now? Is there any difference in any way?
There are a lot of differences.
Okay.
Yes.
So why is the surgery being delayed?
Actually, the surgery has been delayed because of some reasons.
Okay, like what
First
reason?
of all, we need to raise up money for it.
Okay.
And then they also wanted me to get stronger, at least being able to sit up, maybe stand up before I'll be taken to the theater for the
Okay,
surgery.
they need you to be fit for the surgery.
Yes, they're walking me up for the surgery.
Okay, ma. So when do you think the surgery will?
By what we are planning, if the fund is available, if the money gets available before 2 weeks' time,
Okay.
I'll go in for the surgery.
Okay, so like how much are we thinking about for the